We have the pleasure of being joined by Dr. Locks. Dr. Locks, how are you today?
What's up, Doctor?
Ron, hi, JP. How are y'all?
We're doing great,
fantastic.
man. Sorry for the delay. We had a last-minute addition to our guest list, but we're glad to be able to talk to you, especially with Steven Stamkos' injury. We want to get to the procedure that you did for JP. I want to talk about a procedure I had done and how perhaps in the future with stem cell therapy it can be improved on. But a person who already had the surgery, like Steven Stamkos with a torn meniscus, would he benefit and that timeline of 4 months before he returns to the ice? Could you speed that up, Dr. Locks?
Yes, and a lot of the higher-end sports medicine guys are incorporating that into their operative field to try to improve the wound healing process, and Dr. Andrews now is doing it routinely. Mm-hmm. I think that what's very interesting is his choice of physicians, is that he went to Vail at the Stedman Clinic, but he had a lateral meniscal tear, which traditionally don't do well. They're hard to heal, and they degenerate at a much faster rate than the more common medial meniscus. But Dr. Robert Laprede is the director of the complex knee surgery and wrote a textbook on posterior lateral tears. So his choice of physician sort of tells you that it's a tough injury that he had. And so he went to seek out somebody who that's what he's known for. He even wrote his doctoral thesis on posterior lateral tears. So it's a tough injury that he had.
So given the 4-month timeline and also some stem cell therapy that they'll probably use, I would guess in this case after they do some type of repair, how do you think he'll come back? How strong will he be? Will it take longer than that to get back to full strength?
Well, it really depends on what he did intraoperative, and they don't really publish, what he actually did. But if he was unstable, and the degree of what he had to repair will determine a lot of his timeline. But it's a much more complicated surgery, and it's a longer road, which is why you don't see him back like some of the small medial meniscus that in the NFL that pop back in 2 weeks. The lateral meniscus is a totally much more complicated structure, and that's why he sought out somebody who that's what he does all the time.
Well, it's great that he went to the top, expert in the field, and he's a young man, 26 years old. Steven Stamkos is about as healthy as you can get, so hopefully that 4-month timeline, maybe it gets beat, maybe it doesn't. The main thing is that he comes back 100% healthy, and his career stays on pace of what it can possibly be, a Hall of Fame career, and it's not shortened, because if you did cut out the meniscus like Ben Roethlisberger had done, then you have a chance of shortening your career, don't you, Dr. Locks?
That's correct. And if he remains unstable, or if he can't perform at his higher level, then it will affect that outcome. But I think his choice of physicians is sort of telling, is that it's complicated, and he went to somebody who really does a lot of that, and that's kind of telling that he sought out the best, and so that is a very good sign that he's in good hands.
Dr. Locks is joining us, stem cell therapy. This is the man that did my knees, and man, I can tell you, Doc, it's been unbelievable. I stopped playing basketball, I think 6 or 7 years ago, and now my daughter's playing, so I'm out there training and playing with her and playing in pickup games, and it's amazing. I don't have any pain anymore, and more than that, I can just do so much more than I was able to do for so long. And now, will this just continue for me? Do I have to get like a juice up or anything like that, or does it just keep working?
Well, it depends on what you do. If you're playing pickup with Andrew Duncan, maybe.
Yeah.
And he's doing really well as well. But no, I anticipate you should do well. But I mean, anytime you're playing basketball, something can happen to you.
Right.
It's a contact sport.
You did wonders for Derek Brooks, he raves about what you did for his wrists. So you're doing Hall of Famers, you're doing ham and eggers, as we like to say. I had PRP done on my knee. I tore my meniscus a few years ago. And even with PRP, I was hiking. I already had booked this hike in the mountains, and I was hiking 8 days later. I never got my meniscus fixed. It's in good shape. So if I had stem cell now, how much further along is stem cell from PRP?
Well, it's a totally different spectrum, and I think I once told you that PRP is like Kool-Aid, and the stem cells like 151 rum.
Right.
You know.
Good analogy.
And it's not just the potency; it's what you can do long term. So as you age, your knee gets older and you degenerate. So the stem cells are actually important to try to maintain your longevity, so to speak, so you don't fall apart at an earlier age.
Well, I'll tell you what, I'm as active as most 25 to 30-year-olds, so I want to remain that way. And yeah, and when I need it, I'm coming to you, Doc, and I'm having everything done. I'm going to go for a full day.
The Bionic Man.
Yeah, and have knees, shoulders, all of it done. How can folks get a hold of you to get this miracle stem cell therapy and regenerative medicine, Dr. Locks?
Well, you can go online to drlocks.com, or my office in Florida is 727-462-5582, and we also have an office in Beverly Hills, California.
Thank you, Dr. Locks. Have a great Thanksgiving.
Thanks,
we
Doctor.
appreciate what you do.
Thank you very, very much.
All right, buddy. We'll see you. I know you love it.
Yeah.